Another byproduct of the pandemic obviously has been burnout. So how can leaders address the well-being of their staff, and what did you all do at the Mayo Clinic in regards to this? How did it work out?
Yeah, I think there's a couple frameworks I like here. And so one is there are multiple levels of thinking about burnout and well-being. And often if you go on social media, you're oftentimes going to be seeing individuals complaining about others, things that are being done to them. And that is one area. I mean, there are things, we're in situations which are quite difficult and that can cause burnout. But I like from an organizational perspective to think of like three different layers. And so one is at the organization, is burnout and well-being important? Are we measuring this? If we're not, then it's like me seeing a patient. I need to see the vital signs. If I don't see the vital signs, I'm likely not going to take good care of the patient. And so if you're running an organization and your vital signs are your costs and your revenue and your quality, but you're not looking at the burnout and well-being of the individuals who are actually producing that, we know that this is going to decrease quality. This is going to increase employee churn. This is going to decrease revenue, all those sorts of things. And so we want to be looking at that level. There's a second level, which is the way that we're interacting with each other. And so this is the way we're holding meetings. Are we working with individuals who are positive with each other? Or are we looking at individuals who are at odds with each other? Are we holding meetings where we're hearing the voices of and different perspectives of those within our diverse group of individuals or not? If we're not listening to each other, it's prime for burnout. And then the final thing is that individual level, and that is what are the things that we can do individually. And so exercise important, eating well is important. Sleep, I know if I'm not exercising, eating well, and sleeping well, I'm going to be kind of crusty and I'm more likely to be burned out. And then also we hold assumptions about things. There's things that we believe which may be based on our past experience that I think it's good for us to question. And so that's kind of one framework. And then the second framework I think about is well-being. So what is well-being? And if I were to ask, and I give a talk to all of our new physicians and scientists as they're coming into to Mayo Clinic, and I can ask them, so name the 4 chambers of the heart, and they can name them, or like right. name the 12 cranial nerves, and they can name them. Name the components of well-being. They don't have names for them. Like we don't. We're talking about well-being, but we don't really have a language that we've developed around it. And I love there's some work from an individual, Carol Riff, out of University of Wisconsin, where she's looking at psychological well-being. And psychological well-being is different from hedonic well-being. Hedonic well-being is like, I had drinks last night and had a great meal, and today I felt good in the moment, but today I don't feel so good. So that's one sort of like, hedonic well-being in the moment. We're not talking about that. We're talking about psychological well-being, which is long-term. And there's this kind of mnemonic I created called pagers. And so P is purpose. And so we're going to be closer to well-being if we feel like we're involved in things that are aligned with our sense of purpose, our sense of values, the mission. And so when the organization and ourselves are in alignment, going to be good. The A in pagers is autonomy. And this is a sense that we can make a difference, that we're being heard. We have perspectives, not the sense that they're going to do what we want them to do, but the fact that when we move forward, we have a sense that we were heard and we were considered as we were moving forward. And G is personal growth. This is the sense that we can improve today. We can be better today than we were yesterday. E is environmental mastery. This is the sense that we have the resources that we need, or that at least the organization is trying to obtain the resources that we need to get the job done. R is positive relations with others. And then S is, and this is one that I see at all levels as I'm coaching from CEOs on down, this is the ability to have self-acceptance, to accept the fact that we at times make mistakes and that we can move on from that. It can be difficult. If any of these pagers, purpose, autonomy, growth, any of these sorts of things are hurt, we're more likely to be burned out and have less well-being. And so you can now think about systemic causes of autonomy. You can think about the way that we're interacting and how we can encourage autonomy. We can think individually how we can encourage our sense of own autonomy. I like to put those two kind of frameworks together.